And Ann, I'll probably get your name wrong, so please jump in and help me.
Don't worry.
I went to 8 different elementary schools and never quite got phonics.
Right, Mayor?
We're good? All right. Good morning. Welcome to our 9th week of doing a weekly Mayor's Breakfast. We're focusing primarily on trying to bring good information to our residents on the COVID crisis. And I appreciate those who are watching, and of course, those who come back to the site afterwards and watch this on YouTube. I want to thank right off the bat Steve Spadowski, our Deputy City Manager. He coordinates all this, and he's the musician behind the curtain that makes this all work for us. So Steve, I appreciate that, and that anybody who has any questions who wants to for our guest today, please address them to info@sanramon.ca.gov, and you'll probably hear that again. If we don't get to your question today, we'll circle back to you and continue to write in questions or topics you would like us to cover, as we want to bring information to you that's important as residents. So I'll quickly do an introduction. We have, of course, Joe Gorton, our city manager, and Joe's been here every week too. Joe, thank you. We have our county supervisor, Candace Andersen. She's been here every week for 9 weeks, and I want to thank her for making that commitment. From the city of San Ramon, Kathi Heimann, who is our Parks Director and Community Services, and she'll be talking about our summer programs. We have from Kids Country, Ann help me, Ann. Tancioco, thank you, an Executive Director running all of our, not ours, but 15 daycare centers here on the San Ramon Valley campuses. We have a therapist here today, Dwan Brennan, who works with families and also works with people who've been through trauma and helping them work through the stress. I thought that was a very timely thing. And Dwan, thank you for being here. We have 2 fabulous, highly recommended doctors to come and talk to us and give us some perspectives. There's Dr. Herrera, Tri-Valley Pediatrics. Dr. Herrera also works with the Alameda County cities in Pleasanton and around that area to help them as they look to reopen their schools. And we have Dr. Floyd, and she is an associate professor at the Stanford School of Medicine. And they were going to talk, and our program today is talking about our children. And you can tell by summer programs and daycare and children and the therapist and our county supervisor, how is this affecting our children? What are the things we're trying to do to begin to open things up safely for our children, whether it's the programs and daycare? And we have mental health professionals and doctors to share with us information to hopefully reassure parents on what they can do to keep their kids safe. And so with that brief introduction, I'm going to turn first to our city manager, Joe Gorton, as I do every week, for a brief update on anything he thinks residents should know about this today.
Thank you, Mr. Mayor, and good morning, everyone. As usual, will defer most of my comments to the end to answer any questions, but a couple of updates. As you know, we did fortunately have a virtual wind festival this last weekend. However, it was popular by that standard, and as part of that wind festival, we handed out kites, and that was extremely popular. So there's a lot of kids in the community right now flying kites that they received from the wind festival. The other significant item that occurred is the city council at the previous meeting passed a authorization to expand and allow for restaurants to expand their outdoor seating while this pandemic's in place. And so they'll be able to expand into parking lots and other spaces that normally they're not allowed to expand to, so that they can extend their capacity to help them. So we're excited about that win, which we expect relatively soon, that the indoor seating and actual seating at restaurants is allowed. So with that, I'll also defer to the Deputy City Manager, Steven Spadowski, and just have him go through a little bit of our website, because we always like to direct folks to our website, because it has comprehensive information on a lot of questions that the council, or the community has. So Steven.
Great, thank you. I'm going to share my screen here. And one of the things that I wanted to point out this week very quickly is that if you type San Ramon COVID in Google, what you will come up with is the top link goes straight to the San Ramon resource page, but you can also see some of the statistics related to COVID on the side. I just noticed that a few days ago, and it's a lot of useful information. So if you click the city site, I'll go through this again really quick like I do each week. Any and all information that we come across, we go ahead and put on this website. Links to takeout, delivery, virtual mayor's breakfasts. All of the mayor's breakfasts are here. Food resources, volunteering, other government agencies and elected officials. Everything and anything that you would like to know is on this website related to the government services. And we also have a virtual recreation center, which will be helpful for this topic today, where you have ideas for indoor and outdoor activities and other resources. Also, again, info@sanramon.ca.gov. If you have any questions any day of the week related to COVID or the city, we're always there to answer the questions. And one quick public service announcement, the census is currently underway. And if you would like to receive any info related to the census, you go to cococensus.org and you can find out information about the census. I believe everything has been mailed, as Supervisor Andersen can confirm that. And please respond. Right now, San Ramon, the response rate is at 72%. Last year was at 74%. And it's very important that we get a good count of the residents in San Ramon, because it's related to federal and state funding, and it really affects us down the road. So if you haven't responded, please respond. I don't know what the status is on people knocking on the doors and calling you, but if you don't respond, you might get bugged. Thank you.
Thank you, Steve. Great segue right into our county supervisor, Candace Andersen. And Candace, I dropped a note saying if you could keep your comments this week concise, because we have lots of guests. And so thank you very much for
Thank you for that
agreeing to
gentle
that.
reminder, Bill. I just set my timer on my clock on my phone, so I won't exceed my 8 minutes. So you keep your ship running. So thank you, Steve, for that mention of the census. We absolutely, it's critical. And you have one of your local residents, a part of Monte Ready, who has just taken charge with census. Yes, you need to respond, because it does cost us several $1,000s per person per year in federal state benefits. And it's really easy to just do it online. It does not ask any personal invasive questions. So please do it. As always, I want to start by thanking the community for all you are doing to continue to slow the spread of COVID in our community. The reality is it's still out there. We are seeing daily, we are seeing a significant number, on average about 24 new cases in Contra Costa County. But it's manageable at the moment, and can encourage you to continue to go to your city website, coronavirus, cchealth.org as well for that data. So San Ramon, you had 3 more cases this week. And so you're up to 43 cases. It's present in your community. And the point of that is, when you are in close proximity with others, please continue to mask so we can help avoid the spread of it. You may not know that you're ill, but you need to do that, and do your hand washing. Continue to not touch your face where possible. Hospital numbers still looking good in the county. Last week we had 13 in the hospital. We're right about at the same level. The one disconcerting thing we've learned is that in West County, which is Richmond, San Pablo, a lot of those patients are going to Alameda County hospitals for treatment. So our number may actually be almost double. We may actually have 25 Contra Costa County residents who are hospitalized, but half of them are being hospitalized in Alameda County. So let's talk about what's new. The current health order that we're all being governed went into effect almost 2 weeks ago. It will be 2 weeks from Tuesday. It did not have an expiration date on it, unlike other ones. So it doesn't just expire on June 1st. However, every 2 weeks, our health officer, in conjunction with the other Bay Area health officers, is revisiting the order. And we do anticipate a wonderful modification that we're all looking forward to coming out on Tuesday, that would be going into effect on Wednesday. Not sure of all of the details yet, but in my conversations with Dr. Fornatano in a meeting earlier this morning, he did indicate that in all likelihood, absent just some horrible thing happening over the weekend with huge surge in cases, that we will see more office spaces being able to open back up, still encouraging people who can work from home to do so. That's much safer, but we will be allowing offices to open up. Try to encourage limited services now that don't require close contact. So those of you who have not had house cleaners that regularly do, you will be allowed to have your house cleaners back in the house. Essential business piano tuners will be allowed to come back into your homes and tune your pianos. Again, all appropriate social distancing will need to take place. Outdoor museums and galleries will once again be allowed to open, again outdoor, but nevertheless you have a treasure in your backyard here in San Ramon that will be able to open up as well very soon. Indoor retail looks like it will also be allowed to open up, but with limitations, much as we do when we go into essential businesses like a grocery store. So we're going to be able to see much more of our retail open up. Any malls that we do have enclosed malls would have to file a safety plan with the county health officer. We don't do that with a lot of things, but because of what we're learning more and more about this virus, how it spreads indoors so much more than outdoor, it's going to be really important to have those orders or those plans approved to ensure that we're keeping the public really safe in those circumstances. And the other thing that we will be seeing is more allowed activities. We anticipate, and this is a great discussion of your topic today, is that childcare camps are not going to just be limited to people who are allowed to be working under the order, but to more people. Other thing that we anticipate coming out is allowing more social gatherings beyond your own household. We were going to want you to sort of choose your next sphere of influence that you want to interact with, not multiple spheres of influence, because then you may start infecting one another, but we are looking at expanding that as well. And then one of the most important things for many people is that religious services, we're not ready in our county to jump on board to the full 100 indoor services, but it looks like outdoor services for up to 100 people following appropriate social distancing will be allowed. And so again, all of this is contingent upon the health officers negotiating, making sure that they're comfortable with these. We may see a little variation county by county, but it is another step in the right direction because we fully understand just how frustrating and challenging this has been because we're doing relatively well in our end of the county. We do have new cooling centers that were open. Luckily, we're through our big heat wave, but we did have those open yesterday in Antioch, Pleasant Hill, Hercules, and Richmond. So many people in our communities don't have air conditioning, and the traditional places they would go to get cool, like a mall or a theater, shopping center, they weren't open. And so we're glad to see that happening as well. And then we also have more testing. We want everyone to be tested, especially if you're regularly working with people, but we need to get up to our 2,200 tests ideally a day. We're still about 800 or 900. We're encouraging our healthcare providers to jump on board. The good news at our test sites, we're using a less invasive nasal swab. It doesn't go all the way up into your eye socket anymore. It's one where it's a little bit closer to the bridge of your nose. We've also been able to deal with a lot of the issues with regard to our testing, calling in to make an appointment. So not the same long waits that you had when we first opened up the testing to everyone. So please get tested. And the insidious nature of this disease is you don't know if you have it or not. And so we want to make sure that we're able to work with that. We are coming out with a new health order today that is going to be requiring our senior skilled nursing and senior living facilities to have regular testing for both the residents who are living there as well as the healthcare professionals. And so we're going to want a baseline and then regular testing after that. So later today, you will see a health order coming out, which is very similar to implementing some of those provisions that the state has required as well. Continue to look at where we're going with our benchmarks, but the good news is we're continuing to see changes. People are, we're still not encouraging to travel this summer. It's still very risky with regard to being on an airplane or other places. But if you are going to drive somewhere, make sure that you know where the destination, what the rules are for when you get there, because some areas of the country still don't have hotels open to anyone beyond essential workers. You know, try to enjoy the beauty in your backyard. And this is, we were talking about beforehand, this is Mount Diablo in the forefront, and I'm just at one of our local San Ramon Danville parks on a little hike taking a picture. So end of my 8-minute report, Bill, and thank you so much for having me here.
Candace, thank you so much. Next, I'd like to introduce Kathi Heimann. She's our Parks Director, Community Services. And I know that her plate has been so full this last couple of weeks as she navigates us beginning to reopen our summer programs. So what are they going to look like, Kathi? You're on mute. Thank you.
I'll get that unclicked. Sorry about that. We're really excited to be able to offer summer programs. You know, there was so much uncertainty. And so I don't know if you all realized, but we surveyed the community to find out what people really wanted. And what we found out is out of 900 people that responded, the majority really want their programs for their kids back. They're very interested. They just want to make sure that they're going to be safe. And so our Parks and Community Services staff has pivoted from our traditional programs where we bring all the kids together in one big group and divide them into camps, and we have decentralized. So what we're doing is taking the county health orders and we're moving the camps out. So there's no more than 2 programs in any building. So we can keep the kids apart. We're staying within stable groups of 12 children with the same leaders. For in June will be 2-week programs for the youth, 4-week programs for the tiny tots, and 2-week programs for the teens. And we're really excited about all the offerings that we're going to be able to do for people. I might just touch on probably one of the biggest things that I think we're real pleased with right now is our safety. So safety has always been paramount and the most important thing that we can do with our children's programs. So we do the basic, but then on top of that, we've added a whole host of other safety techniques to try and keep the kids secure. So as parents check in, we're going to have a touchless check-in system. We're using KidSafe check-in, where we can actually use a QR code to check the children in and out so they can curbside check in. Once they get to camp, they'll all get health checks. They'll get temperature checks to make sure that they're healthy and can join the group. The camps will all be doing much more hand washing and hand sanitizing throughout the day. And we'll even be doing extra cleaning of our restrooms and all our facilities and touch points every hour. And on top of all that, every kid will be given their own craft or activity pack when they start the week. So they won't have to share materials this summer. They'll be able to manage that. So we're pretty excited about all of our safety things that we've put in place. The camps are kicking off on June 8th, and we've got the full complement of programs from sports to arts, dance, music, some traditional nature-y kind of day camp programs. So a lot of them will be based outside so the kids can get out there and enjoy that nice, healthy outdoor activity. They'll be able to interact with each other and their same leaders in a fun and safe environment, which that San Ramon is kind of known for. Also, if you want to sign up for any of our programs, they're all on the city website. You just go to www.sanramon.ca.gov/parks, and you can find the full schedule that will take us through all of June, July, and the beginning of August. And there are different camps every week for different age groups. Again, we're starting with the 2-week sessions, and we have high hopes that we'll be able to move to 1-week sessions in July. Does anybody have any questions about what we're going to be doing this summer?
From the panelists first, if not, I know that Kathi, you're going to hang around because there may be lots of questions that are going to be following up by the time we end all this.
All right.
And
great.
also you invited Becky Adams to be a part of this, and Becky can be able to drill down and give more detailed answers if there are questions.
Absolutely.
Super. And I want to thank Becky for being a part of this. Thank you, Becky. Anything else, Kathi, before we move on to our next person?
No, I know you've got a lot of panelists today, But so hopefully if people want to know more about the individual camps and what kind of programs we're going to have in different locations, we'd be happy to share that information.
Super, thank you. Next, I want to invite the Executive Director of Kids Country as they will be opening up some childcare centers next week and then a lot more the week after that. And I know that was one of the most common questions I get asked are people who are beginning to go back to work. How are the children going to be safely watched during the day? As if both spouses, or more importantly, Anne, there are a lot of people who are two working spouses working out of the house and trying to raise their children at the same time, which is extremely stressful and difficult. And so you'll be opening up and giving some options. So Anne, please tell us what's going on and how you're going to handle this.
Absolutely. So thank you, Mayor Clarkson. Supervisor Candace Andersen, it's always great to hear you every week. I've always enjoyed your reports on the county. City Manager Joe Gorton and Deputy City Manager Steve Spadowski. I've appreciated this platform, especially as a resident of the city of San Ramon. Every Friday morning, I've participated and listened and learned. And so I want to thank all of you for always contributing and giving us the information, most updated information to benefit us and our health. I welcome this opportunity to speak about childcare and the changes that are happening in the delivery of service. Kathi touched on a lot of what's changing and how we are delivering our service, and share a little bit about Kids Country. So like Mayor Clarkson said, I am Ann Tancioco. I'm the Executive Director of Kids Country. I take exceptional pride in serving our community in this way. Kids Country is a unique, local, parent-founded nonprofit organization that we provide before and after school care, summer camps, and enrichment opportunities throughout the year. And we've been doing this in this community for the past 35 years. We serve school-age students on 15 of the 22 elementary schools campuses as partners with San Ramon Valley Unified School District. We have about approximately 175 staff, which include our substitutes. And I have to say this, we're proud to be one of the first childcare organizations accredited as an organization through Council on Accreditation, also known as COA. And there's a lot of standards that we had to abide by in order to receive this, this accreditation. So in previous City of San Ramon virtual breakfasts, Supervisor Andersen had touched upon childcare and the new regulations issued through the public health order, stable groups of 12 per classroom. And what that means is that the same children with the same educators or staff for at least a period of 4 weeks as much as possible. And these stable groups can't intermix with other stable groups, which means separate outside times, no shared spaces or materials. And the way Kids Country is going to execute care is the children and the staff who are assigned at a particular program will be the only individuals allowed entry into the building. So we put a lot of protocols in place in order to keep these safe environments. Like the city of San Ramon, we are going to pre-screen children and staff using a no-touch thermometer prior to entry into our buildings. The sign-in process will happen outside of the building. Cleaning, sanitizing, disinfecting procedures are more frequent throughout the day. Kathi mentioned a lot of the same procedures we're implementing. We've also added a fogging disinfection weekly service, and that's on top of our regular nightly service. One of the things that we've also, and I appreciate Supervisor Andersen talking about it, because we've implemented that all staff will get tested prior to working at our sites, and they must wear a mask at all times when supervising with children. We're also creating individualized bins of activities and materials just to eliminate that sharing and cross-contamination. We're sad to eliminate family style meals, but we'll be providing prepackaged or individualized snacks. Playground structures, as fun as it is, unfortunately will be still off limits just due to the difficulty in disinfecting this, the structure. But children will still have outside time and get that physical activity, back in their lives, be able to interact with each other with other materials like balls, hula hoops, jump ropes, you name it, we'll make it happen. And then unfortunately for our summer camps, we've canceled all field trips just to stay contained within our communities. Now, there is a lot of challenges in being able to, to execute this service in a different way. It is going to limit the number of children that can be served at a location, pending the number of classrooms we have available. Most of our locations have anywhere between 2 to 3 dedicated classrooms, which really translates to about 24 to 36 children at a site. During the summer, we normally care for about 500 children weekly, and that capacity brings us down to 65%. However, we're so grateful to San Ramon Valley Unified School District for their partnership and support should we need additional classrooms and there's more need for childcare, especially for our working families. We'll be working closely with them in order to obtain additional space. As a fee-based organization, like many other small businesses, this period in shelter in place, closing our doors was necessary, but it also prevented us from bringing in the revenue that we rely on to thrive. And so those restrictions, serving, less children is just going to, it's going to create a strain, but, Kids Country is so committed to providing the service to the community. We are opening our doors on June 1st. We're doing a phased approach. We have 5 of our sites opening on June 1st, and the remaining 7 of our programs are going to be opening on June 8th. And then the other thing I really want to talk about in regards to all of this is, though the restrictions are necessary and the utmost priority is keeping our children, our community safe, we're committed to that process and to those protocols. And it's going to rely a lot of strong communication between families and between the childcare providers. And I'm just talking in general. And, childcare is such an essential part of our thriving economy. So I feel really fortunate to be part of a community such as the city of San Ramon that supports and recognizes this crucial part of its infrastructure. I'll have to say, childcare industry is going to need a lot of support from our families, our community leaders, government, and the business sector to thrive, especially in times like this, and to remain in business and quality standards for our youngest citizens. And I'll welcome any questions. Should there be any other additional questions?
Thank you, Ann. I'm sure there will be some later on. I want to thank you for all the hard work in getting ready for this. And it's sort of a good segue into our next speaker, Dwan Brennan, because the daycare is going to allow families to actually place their children because there has been so much stress that is in our communities. It isn't just health related, and we have our 2 doctors who are going to follow up on the health issues, but something which is really important to me and I think is not spoken about is this huge underlying mental health crisis that we're struggling with. And our police see it a lot. We have a huge spike in attempted suicides and people who are having episodes that the police are having to deal with. Dwan, you've dealt a lot with helping people survive from stress and trauma. In the time we have allocated here, which is not a long time, but tell us what you're experiencing and some skills you might give parents. Thank you, Dwan.
Yes, thank you so much for having me, Bill. And I'm so excited to hear from Kathi and Ann about the services that are now going to be allowed, because families that I'm working with are definitely
Dwan, your sound is not very good. I don't know if you need to be closer, but the sound is not, but try it again.
Can you hear me better now?
A little bit better, but it's very wobbly.
Yeah.
Is that a good term to use?
I don't know any other way to get it any better.
Oh, that's better.
Is that better?
Good.
Okay. Yeah,
Yes.
I was just saying thank you very much, and I'm so excited to hear about the services that are going to be opened up, because families have been feeling very squeezed. You know, I since I am trained in trauma and stress, I'm very much focused on, there's kind of a couple elements. One is in terms of attachment relationships and how we pick up cues from each other in our relationships. And it's very much how children develop. They're wired for a relationship, and so they pick up cues from parents. Everything from, you know, cuddling and swaddling a baby up to how the parent is responding and managing the home. Excuse me.
Dwan, I'm going to ask for a favor. Your sound quality is, I think, poor enough that we probably should circle back on this, because I'm not hearing very much of what you're saying. It's very difficult to make out. So I'm not sure what adjustment we want to make, but I don't want to short shift what I think is one of the most important subjects we have. So we may need to circle back to you so we have a better quality, okay?
Let me go grab some headphones and maybe that will help.
You might try that. Okay, thank you. Yeah. I'm gonna transition over to our doctors right now, Dr. Herrera and Dr. Floyd. You are both very gracious. Take time out of your very busy days. You guys you come highly recommended to me, and I reached out. I appreciate that you guys spent time yesterday emailing each other to kind of talk about how you're going to coordinate this. So Dr. Floyd, I'm going to let you start this right now, and or you guys, if you have a routine already set, but please go ahead.
Good morning. Thank you so much for the invitation to join you today and talk about COVID-19 in this context for children, in particular about how we can get our children back into an environment that's more normal for them in the safest way possible. Dr. Herrera and I chatted earlier, so we'll probably do lots of back and forth discussion as we talk through things, if that's okay.
Please.
All right, perfect. Just a little brief background. I am an outpatient general pediatrician on faculty at Stanford, and I practice in a small federally qualified health center serving low-income children on the peninsula. And our kids come from all over the Bay Area, and we have some kids that travel to us from Contra Costa County as well. And I'm working with a group of pediatricians in our community, working with folks like yourselves who are really thinking about how we can get our children back out safely and what guidance is important, as well as what other types of supports around trauma and economic stresses our families are experiencing. Just a really brief background, I just want to ground us in the fact that we've heard so many scary things about COVID-19 and how it can affect people in terms of long-term consequences, in terms of death for older folks. For children, what we're finding is that most kids have no symptoms or mild to moderate symptoms at most. When we're talking most, we're depending on what source you're looking at, it's somewhere between 96 to 99% of kids. So we want to provide that reassurance to families to let them know that the health consequences to your child are low in most cases. The other thing that's come up a lot this last week as families are trying to plan their summer is, what about our kids with asthma? I just want to highlight for kids with asthma, though there's much in the media around chronic lung disease and increasing risk for complications in adults. For kids with asthma, all that you need to do is the same things you've been doing. Continue to stay in contact with your pediatrician, continue to make sure that if your child does have asthma, that it's well controlled. I'd like to really dive into how we can keep our kids safe, because when we're in a situation where we don't have exact information and it's changing so often, the concrete stuff is what's going to be most important. This starts at home with parents really grounding our kiddos in what those safe behaviors are. Ms. Tancioco and Ms. Heimann were so gracious in explaining how your planning has gone. Our job at home is to get these kids where they're used to washing their hands frequently, where they know how long to wash their hands, how to use hand sanitizer, not touching their face, safe coughs and sneezes. Those are things that we've all been hearing all over the place, right? The other big thing is masking or cloth face coverings for children. There have been really cute under 2-year-old masks, but those are not needed. Children over 2 are the people who should be wearing masks, and that's in the context when you're outside of your home and you're not able to maintain physical distancing. So the couple of examples that I've been using for families is a family walk. When you're outside together trying to enjoy some outdoor space and you're not going to be in close contact with people, it would be okay for your children not to wear a mask in that context. If they're going someplace where they're going to be around other children, that's when the mask will be important. The other big thing for younger kids in terms of tips for parents to make this easier for them to understand is practicing wearing the mask at home so that when they go out into these childcare environments, they're used to not touching their face and all of those things. Tips that I've been giving parents are for younger children, putting the mask on a stuffed animal or something familiar to them in the home so that it becomes something that's as normal as a special pair of socks that one might wear when they go outside to play. The other thing that has been really, really important is grounding children in the fact that these very concrete safety practices are how they can have some control, and this does not have to be as stressful and scary for them. Our kids are hearing about these things in the media, so making sure that we're explaining to them in child terms what's going on and what they can do and what others are doing to be safe is important. I just want to commend the planning that's taken place so far in really trying to make return safe for kiddos. What we've been telling parents is to ask those same questions that you guys have volunteered for us. So when you're thinking about where your child should go for the summer, asking, what is your process for screening people in the morning? When you're screening, are you screening temperatures? Are you asking about symptoms? Asking in detail, what is your plan for how you can maintain physical distancing? Do you have appropriate masks that are available for your adult providers who are going to be interacting directly with these children face to face? And do you have appropriate equipment that's necessary for kids to have enough hand sanitizer to be able to hand sanitize on a regular basis? The other big thing that is helpful for parents to think through is your backup plan. So when children have symptoms, they're not going to be going to school. The days of giving your child Tylenol in order to get the fever down to get them to go somewhere else, those days are behind us. So it's incumbent upon parents and families to start thinking about when you're returning to work and when you're taking your child into these childcare settings, if you get there and the child has a fever, where can they go instead? That planning ahead of time can be very, very helpful in making this a little bit less stressful for us. And then the last thing that I've been really focusing on with parents is asking what your plan is with our grandparents and all of the other people around you. And just the general reminder that safely interacting doesn't mean that you can't interact at all. And minding both physical distancing and masking when you aren't able to be physically distant. I'd like to leave some time for questions, but my last pitch is just remembering that your pediatricians, we are available, our offices are open, we are here to answer questions, and getting your children in for their childhood immunizations and screenings is going to be very important and continue to be the cornerstone of what we are able to do to maintain safety for all of us.
Great. Dr. Herrera, welcome. Thank you for your patience.
Oh, and thank you for giving us the opportunity to talk and educate our community about what we want to do is to make sure all the kids can play in a safe environment. We think it's so important for our children to be out there socializing, playing, enjoying life. And we've seen in my practice, I'm a pediatrician with a practice here in San Ramon and also in Pleasanton. And we have a practice with several thousand children. And we have seen on a day-to-day basis, when this first lockdown first occurred, it was, we saw the reduction in illnesses. It was amazing to see how people just staying at home can all of a sudden, reduce these illnesses. And I know that COVID-19, we had so many concerns, and it is certainly an illness that we want to try to contain, and flattening the curve was so important. And we saw that with the numbers coming down and keeping it in check. And I think California did such an excellent job, and we really have to thank our entire community in sharing and the sacrifice and the seniors. I know my daughter's a senior at Dublin High School, and just watching the sacrifices that she made to help the community, because we know that the children in general are not the ones being affected as greatly as the elderly and people with chronic medical problems, and the sacrifice that they have made is just phenomenal. And I really appreciate the sacrifice that our students have made. Now it's time, I think, for us to try to get them out there and to enjoy life and to live. And I think this is the opportunity during the summer months when it's hot, when there's lots of sun, to try to get our kids back out there and enjoying life. But we want to do it in a safe way, because the last thing we want is our cases to spike and us to have to shut down these programs. So I know it seems like, what I had prepared, what everybody's already spoken about, Kathi, and I'm just impressed that you guys are just on top of everything and you guys have it all in order. I had everything planned to just like X, Y, and Z, and you guys are all already doing it. I think that I'll go over in brief detail. The first thing is preparedness. We want to make sure we're selecting the right participants, because we want to be careful that there are still people out there that can be very susceptible. So if we have students that are immunocompromised, that have cardiac problems, insulin-dependent diabetics, I'm not so certain that they may be the best candidates for this summer program during this early phase, because I just don't want to see cases erupt and the county being forced to shut down. I do believe if one of these classrooms gets a case, the county is going to be pressured to shut down the summer program. So I do want a selection process to occur. I actually spoke with Baraka. This is one of the conversations we had. I think what we could do is maybe encourage the camp coordinators to have a selection process that allows the participants to talk to their doctor and maybe have a clearance from their doctor, so that those patients, because some of the patients that have asthma, that have mild asthma, for instance, like Baraka was implying, may not be at significant risk for COVID-19, but someone with a very chronic or severe form of asthma, and the doctor should make that decision, someone who might be on lots of steroids may be at risk for COVID-19. And so those are the kinds of decisions that a physician should be making. And the other thing, and the other reason why it may be helpful to have the patients going to their doctor to get these clearances is because a lot of our patients have been avoiding the doctors and they're scared of coming to the clinics. And actually, one of my partners just recently was on the news yesterday because they were trying to let people know that it's safe to come to the doctor. As we know, 40%, there's been a 40% reduction in vaccine rates. And so we're really scared that because patients are avoiding the doctor, now we're going to have a situation where we might have vaccine preventable illnesses becoming an issue at the worst possible time. So again, I would encourage the camp coordinators to have the, if possible, to have the participants speak to their doctor, maybe have a clearance from their doctor to participate so that we don't take any unnecessary risks. We should, of course, limit the camps to 12 children, and they should not be interacting with other groups. They can have exercise programs, interactive games, as long as it's their own group, not one group versus another group. We want to make sure that they stagger the time. So if you have, say, an 8 o'clock start time, the next start time shouldn't be 9 o'clock if you're having an 8 to 9 program. So what I would recommend is maybe having an 8 to 8:45 program and then start the next program at 9 o'clock and end at 9:45. That way you have that 15-minute transition to potentially clean up the classroom, screen the new participants, and have that time. And I'll let you guys figure out how much time. You might need 30 minutes, but I just want to make sure you guys are staggering. It's going to be really important. I was listening to Kathi and Ann. I'm glad you guys are going to be encouraging your employees, especially the camp counselors. You want to try to make sure you can guarantee that it's going to be one person from start to finish and not have multiple people having to do the coordination of these or the teaching of these camps, so that you don't have multiple people interacting with the children. The adults should definitely be wearing masks. I think the children should be encouraged to wear masks, and this is where there's controversy. You have these ID guys, they want everybody wearing masks at all times. And, I am an athlete. I go out there and run, and I cannot wear a mask more than 5 minutes. I get out of breath. I just don't think it's practical for the kids that are doing the sports related camps to be wearing masks. So this is why, small class size, screening those patients to make sure they're the right people so they're not at high risk is going to be really important. And but at the same time, if they want to wear masks, they should be allowed to wear masks and encouraged to wear masks. The screeners should definitely be doing the infrared touchless thermometers, and they should be doing the checklists. And I think, you know, having that checklist be something they can do with the infrared that Kathi was referring to. The I forgot the term, where the screener that you can do in your car and not have to come in would be really great. Again, masks under 2 that Baraka is actually dangerous. You know, there's kids that have been that have apneic episodes that actually are passing away. In South Korea, there's some reports of apneic episodes from kids wearing masks. So no masks under 2. It's really important. And social distancing should be encouraged, especially in the indoor programs as well. Those are probably the main things I was touching on. These diseases of despair that Dwan, I believe it's Dwan. Those are, you know, I can tell you, those are really, in my opinion, scarier at this point in time than COVID-19. We are seeing in my own practice patients that have become depressed. We had to recently hospitalize a patient that had been abused. We recently hospitalized a patient that was on his own, just treating his own depression. He wouldn't even admit to depression, but he was taking vaping marijuana, and he had all of the same symptoms as someone with COVID-19. He had pneumonia, he couldn't breathe, he was short of breath. He had to be admitted to intensive care unit because he was vaping marijuana. And again, he's just bored. And so he was just self-medicating. And so these are some of the things that occur when you lock kids up. And so we want to make sure that we start opening up, giving them an opportunity to have a life, to have fun. And we just want to make sure it's done in a safe manner. Thank you very much for this opportunity to speak to you all.
Dr. Herrera, that's a great segue over to Dwan to see if your sound quality is better. How are we looking, Dwan?
Okay, so can you hear me now?
Yes.
Okay, is that better?
Yes.
Okay, great. Well, I will try and keep this concise because I feel like we've addressed a lot of the ideas, but you know, when I'm working with people and families and being trained in trauma, I'm really looking at the nature and quality of the attachment relationships, because that's how kids developmentally learn and grow, as well as how people's nervous systems are being affected. And so, you know, in my practice, we've really seen sort of a curve in how people have coped and adapted. You know, at first there was kind of a shock about being in this shelter, and then, you know, after a few weeks or a month, what I saw was people's nervous systems really ramped down, and people were like, "Wow, this is actually kind of cool. I kind of like, you know, not having to run around and be in the rat race and on the wheel all the time and running around to all the activities." And now people are getting to a point where they're feeling trapped, they're feeling suffocated. Parents are so stressed because of trying to manage their own work and their kids' homeschool. So I'm so excited to hear from Kathi and from Anne about, you know, some of the activities that are going to start happening again, because I feel like, you know, it's absolutely necessary. You know, kids really need that interaction. We are wired for attachment and relationship. And, you know, when all they have is the relationships in their home that are under increased stress, that can actually have an adverse effect on their nervous system. And what we know is that when kids are under stress for an extended period of time, they can actually, I mean, this is what creates what is commonly understood as PTSD, which is basically that your body's in a fight or flight mode all the time. And that can become a chronic condition that then needs, you know, significant treatment later on. So I've been really encouraging families to find ways under the restrictions that they can get out and have activities, have outdoor time, you know, fresh air, movement, and ways that they can regulate their nervous system, so that they can, you know, maintain their health over the long term. You're on mute.
My apologies.
Yeah.
I was going to say thank you for those comments. Your sound quality is still a little bit sketchy, but we
Okay.
caught most of what you said. So thank you.
Okay.
But we have, oh, that's even better. When you got that up by
Yeah.
your voice, that's
Hold
much
it right
better.
here.
Yes.
Okay.
Yeah.
And Dwan, I'm sorry if I'm mispronouncing your name, but do you have any suggestions for dealing with kids that are having gaming addiction? And I mean,
Yeah.
you know, I've kind of tried different recommendations, you know, trying to tell him, hey, maybe for every hour or two of video game time, they should be giving me giving you an hour of exercise. Do you have any other suggestions, ways to reduce this gaming addiction that we're seeing in our kids?
I mean, it's so interesting you asked me that because I just was working with a client last night whose 12-year-old son has ADHD and it was a significant game issue, and his behavior was just completely out of control. I mean,
Put it closer to your mouth.
the tantrums when she
Yes.
was trying to get him off the game and set any limits. And they ended up having a huge meltdown, and she actually took the game completely away. And she told me last night, I have a completely different kid on my hands.
Yes.
The game is out of the house. It's not even being allowed. And she said he's, you know, cooperative, he's behaving, and, you know, she's going to give a 2-week period and then start to introduce it back. But, you know, I think sometimes parents are afraid to take that extreme of a step, but I don't think that it's necessarily a bad idea, because, you know, kids just look around and think, well, my friends have them and I have them. And I think parents have been hesitant as well, because this is sometimes the only ways that kids are in contact with their friends is over the games. But, you know, it's really not good for the brain development, and they need large muscle movement, you know, and they need fresh air and to be outdoors and interacting, you know, in a relational way, not over a screen.
Dwan, I'm really happy that Dr. Herrera asked that question. We have a mental health advisory committee, rather broad-based coalition of people that we meet every couple of months under Kathi Heimann for the Discovery Center's leadership. And one of the speakers we had, and Dr. Herrera, this is something I wanted to share. The worst form of addiction that's going on now for young boys is the video games. In fact, they find it's more addiction than drugs, and that a lot of the outpatient or inpatient treatment centers find it to be the most difficult addiction to break is young boys and video games, to the extent that most of us left that thinking we would never let our young boys ever play video games. It is, and the stress in a household to try to weed them off the games is one of the most stressful, and it's really bad. So my thought is, I'm not even sure I'd want to reintroduce it. Video games is something which, and Dr. Herrera, you're seeing this, it's tough for young boys.
It's tough,
Yeah.
you know. We had the World Health Organization come out and actually recommend that kids play video games as a way to pass their time, so they're not going outdoors. And I was just shocked by that information.
Yes.
Yeah.
You know, my kids just put it in my face, and I'm like, okay, we have to think about these things. And you're right. Video game addiction is become one of the very significant negative consequences to the stay-at-home order. And it's a hard thing to balance out, because we know that, you know, our kids, that's the way they're interacting with their other. When you talk to my teenagers, if it wasn't for those video games, he would have no interaction with his teenage friends, because that's what guys do. They don't like to call people. They play, and that's how it's like sport. It's almost like a sport. It's replacing their usual sport. And so that's why it's so hard for them, but they don't understand the addiction that's associated with it. And that's why I was talking, and I'm going to mispronounce your name again, Dwan. Anyways, but it is, yeah, something that we really need to address. And I'd like your input and your insights into that as well. You know, while we were on this, Anne and Kathi, you know, the mask issue, you know, we as medical providers, this is another scenario where we want everybody to wear masks all the time, everywhere, you know, and at the same time, we want you guys to have your input of what you think the proper use of masks is in children, and because you guys are in that flux where you're taking care of the kids. You know how hard it is to keep masks on kids. What are your insights into how we should deal with the recommendation to wear masks, and is it really practical for the kids to be wearing masks all day long in a daycare setting or in a summer camp setting where they might be playing outdoors? What are your thoughts on these things?
Kathi, would you like to go first, or?
Doesn't matter, you can.
Well, I think we were talking before we started this that, Kids Country really took some time to marry a lot of different protocols, in order to reopen our sites, and whether it was from community care licensing, Center for Disease Control, obviously, our Contra Costa County public health orders, OSHA. I mean, we looked at everything, and there's kind of contradictory, like, do you do it? Obviously, no masks for children under 2. And with us, we serve school age children, and we know kids, masks are not going to stay on. They're going to forget. It's a new habit, and I think that's what it is. And I think Dr. Floyd spoke about it, like, teaching kids how to wear it, how to use it, not touching their face, and it's a new habit. And there is the wish, and then there's the reality. And the reality, children, that's not how they function. They're still learning about their bodies, and wearing masks. We're just we're following our Contra Costa public health order that says children 12 and under are not required to wear a mask. However, we're letting parents know, should they choose to send their child with a mask, absolutely. Parents are children's first teachers. We're gonna respect parents' wishes.
Yeah, and we're in that same place where all adults and people over 12 will be wearing masks absolutely the entire time, but the children, it will be optional for them, for the families, if they want to send masks with their kids and wear them if they're more comfortable that way. It is a little problematic when you're doing a sport or a very active activity. So sometimes that can become another safety concern, because it's, sliding up, it's falling down, they can't see what they're doing. And so it's a balance. And so it's a balancing act, but we really feel that with all the rest of the safety precautions, with, sterilizing all of our sports equipment and everything else, that we're creating as safe of space as possible.
I'd like to make a comment about the masks as well. And, that is that, with us being wired for connection in the way that we are, and our brain chemistry is designed, what we call neuroception, and that's to pick up cues from other people. And that can be, small muscle movements, eye contact, expressions in the face, body language, tone of voice. And so for young kids wearing masks, to me, I'm just concerned about the impact on how is that going to be coded in their brain chemistry. Older kids, I think, are old enough to kind of grasp and understand, but that could be really scary for a younger kid. And what are the effects going to be of these younger kids being in this environment where masks are on all the time? I think it's really a concern. And I guess my thought about that is just, it's so much on parents and adults to be normalizing or helping kids understand this, because kids are going to pick up their cues on, am I safe? And is this okay? By the way that we language it, by the story that we tell, keeping it very developmentally appropriate. So, those are things we can kind of try to alleviate, but again, it's a scary concept for little kids to be in environments where everybody's wearing a mask.
Thank you.
Steve,
Yeah, and
do we have any questions at all from people from the audience?
We have a lot of questions, and what I do each week is I try to condense them all into topics. So if I don't ask the question verbatim, I'm trying to just cover the information. And again, info@sanramon.ca.gov. If we don't get to them today, we'll get to them at either future Mayor's Breakfast, or we'll get right back to you with the responses. So the first question, again, condensing, What is the possibility that library branches could open for curbside pickup? Also, people are asking specifically about when hair salons will be open up. Not that I need one anymore. Or also restaurants. We know that restaurants, we're doing the outdoor seating as Mr. Gorton mentioned, but does it look like restaurants fully reopening is now pushed back to phase 3?
I'm guessing that's for me.
Probably
So
so.
yes, no. So as far as libraries, we did just approve a plan with our librarian this past Tuesday to allow for curbside pickup of materials, and that should be implemented in the very, very near future. So we're excited to see that happening. That's terrific. With regard to hairstylists, not in the current order that's pending. We know that in other parts of the state where they have been able to do some attestations, and even the governor opening up, not quite there yet, but we're really hopeful it'll be soon. But it's not being considered right now as part of the current health order that the Bay Area health officers are considering. Similarly, opening up outside restaurants is not yet part of that order. But again, every 2 weeks it will be considered, looked at. We know it's important. I have not had my hair cut for 2 weeks, and I'm very grateful that I figured out years ago how to cut my bangs, or I would be looking like someone off the Addams Family, I'm afraid, with my bangs down here. But again, it's incrementally, and we want to see the impact of each order to make sure there's not a surge. And it's been very, very disconcerting to see what's happening in our West County. That means San Pablo and Richmond, that area. We're seeing many, many, many cases that are showing up both in Oakland hospitals, Alameda County too. So that's why everyone's been a little cautious. So, and did I miss any group that you had in there, Steve? Okay. And the other thing, if I can just add, when I mentioned religious gatherings, outside gatherings, that I understand, and we'll see on Tuesday when the order comes out, would be started on June 15th is when those larger outdoor gatherings of churches would be allowed.
Great.
Right, the next question, would swimming or group sports count as expanding social circles? We get a lot of questions about when can group sports resume, and in particular swimming with the weather.
And the challenge is the state has not started even allowing it. And one thing that we keep articulating is that we're going to wait. We're not going to get ahead of the state. Yes, we're lagging a little bit behind the state in some areas, but the state has not yet started allowing that. Where it is allowed, of course, is in camps. And so, San Ramon, Parks and Rec, you can decide, how can you safely implement that with your camp. So swimming is allowed there, but yeah, we understand that people can safely sign up for a time and swim, but right now the state isn't allowing it, and thus our health officers have not yet opened it up as well.
Right. Next question, with so much uncertainty right now, why did you decide to offer summer camps this year?
Well,
Joe, that might be Joe and Kathi in terms of, ask your question one more time, Steve.
With so much uncertainty right now, why did you decide to offer summer camps this year?
Well, I'm happy to take that one, Kathi.
Yeah.
That's an overarching policy, and we're compliant with the the Contra Costa Health Services. And sometimes when these questions are framed, they're only framed on one half of the issue, which is obviously how do we react to the COVID-19 pandemic, and how do we remain safe? And they stay silent on what our panelists have just done a fantastic job explaining all the other issues that confront our children. And so we as a city are take the position that we have to address all these. Otherwise, we do really well in one area, say the COVID-19 response. However, we leave the rest of these issues unaddressed, and that has a whole host of consequences, as our panelists described. So we will continue to stay compliant within the health officer and trust their opinion on when to move forward. But when they say move forward, we are moving forward.
I want to echo Joe's comments that we have a health crisis with COVID. I think in terms of our community, we have even a larger crisis around mental health. and how families are functioning, the relationship between families and their children and between their other friends. We have kids who are isolated and who are not doing well. Let's be honest with ourselves. We have lots and lots of children who are not doing well, and we're seeing, and we will continue to see a lot of residual damage from that. And so I want to compliment the city manager on taking that lead along with Kathi and Becky and putting together programs to allow our children to be children in a safe way, but their mental health is just as important as their physical health is too. So thank you for letting me get on my soapbox for a second. Go ahead, Steve.
And if I could just, oh, sorry.
And Mayor Clarkson, can I also comment on that?
Please.
I also want to speak to the fact that summer camps are opening is because many of our parents are going back to work physically. And so having spaces where their children are safe and able to be a child is going to be crucial, you know, as our economy slowly opens up. And so summer programs that the city of San Ramon provide, other childcare providers, you know, throughout our city, Kids Country included, need to be, you know, I spoke about the, we're an industry, but at the same time, we're a critical infrastructure to an economy. We need to be there in order for families to work. And I think it's appropriate, as many businesses are slowly opening up, that we're going to be there for our families.
Thank
And
you,
Mayor
Ann.
Clarkson, if I might add something really quickly.
Please.
I think the other part to think about, we're talking about how the mental health consequences and the stresses for families, just grounding in evidence and what we know about how kids can rebound from stress and prevent long-term outcomes. Outdoor activity and play are a big cornerstone to the way that we respond to stress and what we recommend for families when we're thinking about a child or a family who's been under a lot of stress. So that's part, and the timing of this being summer and us being able to do that and facilitate kids getting that outdoor activity not only is helpful for our parents to go back to work, but is therapeutic too.
Dr. Floyd, thank you. Steve, any more health questions?
Yes, and this might be the last one given the time and the possible response, but can someone describe the relationship between with children with COVID and inflammatory illness? What about Kawasaki disease?
Baraka, you got that one.
Yeah, sure. So first of all, Kawasaki disease is a relatively rare condition in children, usually of school age. What we're finding with COVID is that some children are affected with a syndrome that's very similar to Kawasaki and what it looks like. So things that you might see are fever, sore throat, rash. Most kids end up having more GI symptoms, so like vomiting and diarrhea, than the sore throat and cough that we're seeing with adults. With this particular condition, I just want to continue to underscore it's very rare. We are still at a point right now, even though the CDC has issued guidance for us as pediatricians to be mindful that this exists, that the number of cases are still very low. We're still under 10 for the entire country. So we need to be able to take all of that into account as we consider how much of a risk this is for our children. When I tell parents what to think about when you have a child that has fever or sore throat, that's when you reach out to your pediatrician for us to look for whether or not there are signs or symptoms that are concerning for this actual condition. Dr. Herrera, I don't know if you have anything to add.
No, I think you did a great point. You know, it's extremely rare. I think that's the important takeaway. Kids have a very strong immune system, which is protective against COVID-19, but one of the consequences of having an overactive immune system is sometimes you get these kind of overreactive situations like this multi-system inflammatory syndrome. And although it is scary, it's incredibly rare. And again, it's really important that parents see their physicians when their children have these unusual rashes or unusual symptoms, because early treatment, early identification can make a difference.
Thank you. I like to summarize by saying, if your children or any adult has any medical situation, do not delay, do not postpone going to a hospital. or to see your physician if you're not doing well. I think that is one of the hidden collateral damages that we're experiencing. Our people are delaying going to see their doctors, and they're having a lot of problems with that. I want to thank Dwan for all the work that you and everybody who's doing in mental health. You guys are carrying a huge load right now, and it's something that we want to say thank you to everything you're doing. And you guys organizing along with Kids Country and helping to place children in safe environments when their parents have to go off to work, of course. Our county supervisor, of course, Candace, thank you for all your work. Continue to carry our case forward to our county health officer that we can open up safely, but open up as appropriately and as quickly as we can safely. And we thank you for doing that. Absolutely. Kathi, all the yeoman's work you've done these last few weeks, along with Becky and everybody else in your crew, to prepare a very safe summer program for our children. And of course, always to both our doctors, thank you for taking time out of your very busy days and taking care of our young and most vulnerable people, our children, our most precious gifts. Joe, thank you to you and Steve for organizing everything. Have a great, safe weekend. And thank you to everybody.
Thank you.
Thank you.
Take care. Bye-bye.